Common signs of cancer in women can include persistent fatigue, unusual lumps or areas of thickened tissue, unexplained weight gain or loss, noticeable skin changes, bowel or bladder habit changes, ongoing cough or breathing trouble, issues swallowing, hoarseness, long-term indigestion, unexplained aches, and unusual bleeding or bruising. These symptoms can be caused by other health issues too, but it's very important to see a doctor as they continue or raise concern. Here's a more in-depth overview. General symptoms in women that may indicate cancer. Fatigue, feeling constantly drained even after a full night's sleep or regular rest, can be more than just a busy lifestyle. In women, extreme ongoing fatigue can be a sign of cancers like leukemia, colon, or ovarian cancer. If you're feeling wiped out without a clear reason, it's worth talking to your doctor. Unexpected weight changes. If you're losing or gaining weight without any changes in your eating habits or exercise routine, don't ignore it. Unintentional weight loss, in particular, can be linked to cancers like ovarian, pancreatic, or stomach cancer. Sudden weight gain, especially bloating around the abdomen, can also point to ovarian cancer. Skin changes. Your skin can offer early clues. Keep an eye out for things like yellowing of the skin or eyes, jaundice, darkened areas, new redness or sores that don't heal. Women should also watch for new or changing moles, as these may signal melanoma or other skin cancers. Pain. Persistent pain that doesn't go away, whether it's in the back, pelvis, breasts, or joints, can be a red flag. Breast pain that doesn't follow your usual menstrual cycle, or pelvic pain that continues for weeks, could be associated with cancers like breast, ovarian, or uterine cancer. Don't dismiss long-lasting discomfort. Fever or night sweats, having unexplained fevers or waking up soaked in sweat, not related to menopause or illness, may be connected to cancers like lymphoma or leukemia. If these symptoms continue for a while or come with other issues, it's time to get checked. Area-specific cancer symptoms in women. Breast changes. If you notice something different about your breasts, like a new lump, an area that feels thicker than the rest of the tissue, or changes in the way your skin looks, it's important to pay attention. Signs such as nipple pulling inward, inversion, unexpected discharge, or skin that looks puckered, dimpled, or red may be early indicators of breast cancer. While not all breast changes mean cancer, it's always best to have them checked by a healthcare provider. Catching any problems early gives you the best chance for effective treatment. Changes in bowel or bladder habits. If you're noticing shifts in how often you go to the bathroom or how it feels when you do, it's important not to ignore them. For women, symptoms like frequent urination, a sudden strong urge to go, blood in the urine or stool, ongoing constipation, or changes in the size, shape, or consistency of bowel movements could point to issues in the digestive or urinary tract. These symptoms might be linked to cancers such as colon, rectal, bladder, or even certain gynecologic cancers. If these changes stick around or worsen, schedule a visit with your healthcare provider to find out what's going on. Abnormal vaginal bleeding or discharge. Any unexpected vaginal bleeding, such as spotting after menopause, bleeding between periods, or unusually heavy cycles, should be taken seriously. In addition, discharge that looks different than usual, has a strong odor, or changes in color or texture can also be a warning sign. These symptoms may be early indicators of gynecologic cancers, including uterine or cervical cancer. According to health experts, including the CDC, it's important not to overlook these changes. If you experience anything out of the ordinary, reach out to your doctor for a proper evaluation. Pelvic pain or pressure. Ongoing pain, discomfort, or a feeling of pressure in the lower abdomen or pelvic area, especially when it doesn't seem related to your menstrual cycle, can be a red flag. For women, this kind of persistent pain may be linked to cancers of the reproductive system, such as ovarian or uterine cancer. If it lasts more than a few weeks or is accompanied by bloating, back pain, or changes in bathroom habits, it's important to get it checked out. Persistent cough or breathing trouble. A cough that lingers for weeks, especially if it becomes worse over time or produces blood, can be a warning sign of something more serious than a cold. Trouble catching your breath, wheezing, or chest discomfort can also point to lung cancer, even in women who don't smoke. If your symptoms don't go away or seem unusual, talk to your healthcare provider for a full evaluation. Trouble swallowing. If swallowing food or liquids becomes painful or feels like things are getting stuck in your throat or chest, it may be more than just heartburn. For women, difficulty swallowing that doesn't go away could be linked to cancers of the esophagus, throat, or nearby structures. If this symptom becomes persistent or worsens, it's a good idea to see a doctor. So, mouth changes, sores in the mouth that don't heal, red or white patches on the tongue or gums, or ongoing pain in the mouth could be early signs of oral cancer. These changes are sometimes overlooked, especially if they're not painful at first. Women should pay attention to any new developments inside the mouth, especially if they last more than 2 weeks, and bring them up during a dental or medical visit. Swelling or lumps. Noticing a new lump or swelling in areas like the neck, armpits, or groin can be concerning. These might be swollen lymph nodes, which sometimes signal infections. But in other cases, they may be early signs of cancers such as lymphoma or other systemic diseases. If the lump is firm, painless, or doesn't go away within a couple of weeks, it's best to have it evaluated by a healthcare provider. Most common cancers in women. 1. Breast cancer, the most commonly diagnosed cancer in women. Early signs include lumps, nipple changes, or skin dimpling. 2. Lung cancer, second most common cancer in women and the leading cause of cancer death, linked to smoking but also occurs in non-smokers. 3. Colorectal cancer, colon and rectal, often starts with polyps in the colon or rectum. Symptoms may include blood in stool, changes in bowel habits, or abdominal pain. 4. Uterine endometrial cancer, most common gynecologic cancer. Postmenopausal bleeding is a common early symptom. 5. Ovarian cancer, often goes undetected until advanced stages. Symptoms can include bloating, pelvic pain, and urinary urgency. 6. Cervical cancer, caused mainly by HPV, human papillomavirus. Regular Pap tests and HPV vaccines can help with early detection and prevention. 7. Thyroid cancer, more common in women than men, often detected as a lump in the neck or changes in voice or swallowing. 8. Skin cancer, including melanoma, includes basal cell carcinoma, squamous cell carcinoma, and melanoma. Early signs involve changes in moles or new skin lesions. 9. Non-Hodgkin lymphoma, affects the lymphatic system. Symptoms may include swollen lymph nodes, fatigue, or night sweats. 10. Leukemia, cancer of the blood or bone marrow. Symptoms include fatigue, frequent infections, and easy bruising or bleeding. Key takeaways. Many of these symptoms can result from non-cancerous conditions, but that doesn't mean they should be ignored. Catching cancer early often leads to better treatment results and more options. If you've noticed symptoms that persist or worry you, don't hesitate. Make an appointment with your doctor as soon as possible. Thanks for joining us today. We hope this information helped you feel more informed and confident about your health. Remember, staying aware, asking questions, and seeking timely care can make a real difference in your well-being. Your health matters every day, so take care of your body. Listen to the signals it gives you, and don't hesitate to reach out